Dr. Michael who's the Physicians Advisory Group Education Committee Chair. Thanks for joining us, Doc. It's been a minute. How you doing?
Hey, I'm all right. Good morning, guys. Nice to see you guys again.
Nice to see you too.
So what's up? What's the discussion with the PAG? Are you guys like? They still talk about education, or is it just kind of like, hey, they're in face to face?
We
So
haven't, yeah, we haven't had an educational subcommittee for a while now. I think once we kind of got the ground rules in effect,
right.
it was up to the schools to take care of it, and it seems like they've been doing a pretty great job. Obviously, we had our cases are low, really low in the on island, and we haven't had any kids that we were worried about getting COVID. And most of our PAG meetings now are slowly shifting, pivoting toward the future quarantine and the different new rules. And I'm really hoping that maybe we can find a way to incorporate vaccination status. But as you could probably imagine, right now there's no way we can really verify if people really got the shot coming from off island. I mean, it's just a paper card right now. So there's going to be a lot. I'm sure there's going to be a lot of discussion going forward in the future about that.
What do you think? I mean, how do we do that at least locally? Because Dr. Hoa freaked me out. He's like, oh yeah, anybody could do the card.
You could feel
Yeah,
that way.
I don't know.
But he
I
said,
mean,
there
right.
is some sort of a database, right? This WebMD or WebMZ or something. But the only people that have access to it, he said, was public health. Is that correct? And is
Oh,
that just a
it's
local database or a national database?
so there is one for Guam. It's the immunization database that's online, and the clinics have access to it to put it in. It is only a local one though, so it's managed by the state. So I know like California had a separate one. The thing is though, like it depends on people actually putting it in, and I don't know if there's actually a way to verify if they've actually done it. So, you know, it's just somebody at a clinic just logging it in, and then that's just in the database. But I think we just use that for reference. And right now, still the gold standard in clinics is if they come in with their little shot card with a little stamp on it. That's the gold standard for right now. So as far as can we use that maybe for returning residents down the line? I know there was some question about with people coming off island, probably will have to require like a 72-hour test. But it's going to be a question of if we have residents that are going off island, and Guam's been doing a really great job of getting the vaccine out, and they come and they have their shots and they come back off island, do we still need them to quarantine? We're not sure yet. Those are questions that we're going to have to discuss and look for the data in other places to kind of rule out. So all of
So
that, so right now, a lot of it's just a lot of stuff to discuss.
Mhm.
So
Um,
there's there was no requirement or anything when public health was giving vaccines to private clinics for them to administer these shots that there's a requirement that, okay, you have to keep a record and you have to input it into or report it back to public health.
Oh, I think it definitely was.
Okay.
I'm not involved in giving the COVID vaccine, so I don't
Okay.
know the ins and outs of this. But as far as putting it on the Guam Web IZ, I think that's what the immunization program is called, the online database. I don't know if they have to do that, but again, I'm not involved in giving out the vaccine for COVID.
Okay. But that Web IZ, is that for all kinds of vaccinations or is it just specifically for
Yeah,
the? Okay.
yeah. Mhm.
Hmm. I know that Dr. Wynn was saying that there was discussions or there's something that public health can purchase. Is that what you remember, Chris?
Mhm. Say again. Sorry, someone
That
was at the door.
Dr.
I,
Howell was mentioning there was some sort of program or that public health could purchase so that we could create some kind of
mm,
a database where you can check whether or not individuals have
Right.
been
Yeah.
vaccinated.
Because he brought up the same concerns
oh,
as you, Doc. He
yeah.
said right now anybody could just counterfeit that little white card and claim they're vaccinated.
Yep. Yeah, and I don't know what it looks like from other states either. I just
Right.
so who you could do like it'll be like getting a fake driver's license, I guess,
And back
before
in the
everything was
day,
like a real
they
ID.
knew you got it because you had that thing on your arm.
But this is something that the
Right.
PAG is talking about because that's kind of concerning
Yeah,
if
it's a
We're not.
Yeah, it's a big. And I mean, it's beyond just us too. I'm sure other states are trying to
Right.
figure out, and other countries are trying to figure out because we're not the only places that want to open up, of course.
Right.
But how do we do it so everybody's just about as safe as they can be?
And I wonder also with the reopening of the proposed reopening of tourism on May 1st, the governor had also mentioned that they were probably going to end up changing quarantine protocols. I'm not even sure if that was for returning residents, but you're right, returning residents who have been vaccinated. It kind of seems like, I don't know what the science says, Doc, but it kind of seems like the option, right, for them to just go straight to home quarantine, if anything, should be considered. But how do we know if they're even really, really vaccinated? Right.
Right. But I mean, for right now, for us on island, with the vaccine rolling out and the uptake that I see in the community has been a lot more robust. We're not getting the resistance that you see in a lot of places. And I think it's because we're a lot smaller and almost everybody has been hit, really personally by this. If not by a direct family member, then by a few degrees of separation. And if everybody, if we get to the goal and getting just about everybody that can get vaccinated. I mean, we're seeing the data from the Pfizer and Moderna, it's 95%. Johnson & Johnson, even if that comes out, it's going to be like 64%. Imagine if we were all vaccinated before, like if we had a time machine and we were all vaccinated before COVID hit the island, all these hospitalizations, if we were able to cut that by like 66 to 95%, it wouldn't have been a problem on island, right? Our hospital capabilities would have been totally adequate. And life back then, or if we had it back then, life could have gone on probably as normal.
Right.
So if we imagine that the entire island is going to be vaccinated and we have some people coming in off island, with that negative 72-hour test coming in off island, the likelihood that the virus would gain a foothold and really spread quickly like we saw in our spikes, that's becomes much less of a threat, assuming, of course, that we don't get some crazy new strain that evades the vaccine, that evades quarantine.
Right. Let's talk about crazy new
Which is
strain.
a big assumption.
Yeah, because I mean, we heard a lot about these variants when they first came out, but I mean, and I do pretty routine Googles. I haven't really seen a whole lot about it, and we're still waiting for the results from the samples we sent off to the CDC. So just, I mean, as as a doctor, what you read, what are you finding out, and what do you know about the variants and the threat that they pose?
So the most encouraging finding is that they don't seem to be evading the vaccine completely. It seemed like with some of the strains, and I forget which ones exactly, maybe the current vaccines are just a little bit less effective, but still, better than nothing. With some of these strains, I think the Brazilian one and maybe the South African one, they were much more contagious. So not necessarily more deadly, but just on the terms of absolute numbers, if just more of the population gets it, then more people are going to need hospitalization and more it'll be higher mortality in absolute terms. So as long as we keep getting vaccinated, we're doing the right thing, and people are still really good about social distancing and wearing masks, washing their hands, and everybody's doing the right thing.
Right. Are you kind of keeping track of what's happening over in the CNMI? How they had like a spike of like 10 cases after going without 200 days of community spread, and then come to find out that the first person, it was on Friday night, he's 147, right? He tested positive even after being fully vaccinated.
And then through the contact tracing, they found out that he had spread it to other people.
Yeah.
Oh, interesting.
Yeah. As an asymptomatic.
I have not. I haven't read up on that. I just kind of saw the headlines and caught snippets of your interview with somebody yesterday.
Yeah.
That mentioned that. I would need to know more details before I start,
Okay.
putting out possible thoughts on what might have caused that. The vaccine, though, the Pfizer Moderna, it is 95% effective, so it isn't 100% effective. I guess there's that's one possible thing that could have happened, but I would need more information.
Okay.
All right.
When's the next meeting? Thursday? Tomorrow?
Yeah, Thursday, tomorrow. Yeah.
What's on the agenda?
We'll
Do you
see.
guys get like an agenda, or is it just you show up and are they in person or Zoom?
It's all Zoom still.
Okay.
We haven't had an in-person meeting since, I don't know,
Right.
before August, I guess.
Yeah.
But yeah, I mean, probably talking more about possible quarantine guidelines. That's just been kind of, something to kind of mull around and keep talking about and figure out. It's never super quick. There's a lot of stuff to discuss and consider, a lot of viewpoints to get.
Yeah.
Yeah.
Talking about viewpoints, what was your viewpoint on this back and forth? It's been kind of quiet between Dr. Cabrera and Dr. Shea. I mean, this was hot, and now we haven't heard anything.
Oh, somebody else showed that to me briefly. I was having a really busy week because that's why I had to reschedule you guys with the hospital and clinic, and I really haven't been keeping up with it. So
I'll send it to you.
Going on.
Yeah. It sounds like you don't want to get involved.
But yeah, I'll just leave it at that.
Yeah.
There you go. All right. We'll give you an
good
out.
answer. Good
we'll
answer.
give you an out, Dr. Dr. Yeah, don't be asking me that. Okay, Doc.
Thanks, Doc.
All right, great seeing you guys.
Okay,
You
see you.
too.
Yeah, be safe. Dr. Michael